on your left.
Tampa tonight. The mayor is saying that the city and our healthcare system are in a crisis with the way the virus is tearing through people. Let's go to Fox 13's Catherine Hawley now live in Tampa with more. Catherine?
Chris, hospital beds are filling up and staff across the region are stretched thin. Local leaders say it's critical that everyone get vaccinated for COVID-19. Hospitals across Tampa Bay are packed with patients. The pandemic has never been this bad.
These are younger people who are healthy. They had no symptoms. They have no chronic disease. And all of a sudden, they're ending up on a ventilator and passing away. 19 to 64-year-olds.
Doctors, city leaders, and COVID survivors coming together Friday to send a strong message to everyone in our area. If you're not vaccinated, you need to reconsider.
With this Delta variant, that if you have not been vaccinated, then you have around 100% chance of contracting COVID-19.
According to the Department of Health, the current positivity rate in Hillsborough County is 23%, and only about half the residents over the age of 12 are fully vaccinated.
I could only equate what I went through as hell on earth.
Nick Hansen contracted COVID-19 in December 2020 and is still dealing with symptoms. He has long COVID and says this virus carries the risk to impact how you function every day for the rest of your life.
I have no pre-existing conditions. I went to the doctor every year. I consider myself pretty healthy. And if it can do that to me, it can do that to anybody.
He's since been vaccinated for COVID-19 and joins medical experts saying the shot will help get us out of this crisis and could save your life.
Getting vaccinated protects everyone. Those who've had COVID, those who think their immune systems will fight COVID. This is not about our personal health. It's about each other.
And there are numerous testing sites now open and vaccines are readily available. Officials say the only place you can't get a COVID shot is once you land in the hospital with the virus. Chris.
Catherine Hawley live for us tonight in Tampa. Thank you, Catherine.
Hey, my Airboat brothers, back again. You know what? I think I'm going to start doing more COVID news again. I had stopped because, one, the virus had died down for a while. It had gone flat, so there really wasn't anything new to talk about. And secondly, had done it for like a year, a little over a year. And sometimes you just get tired of something, right? So that's what happened. But since I, started putting up just little bits, not a whole lot. I actually was talking more about the lockdown really than about the disease itself. And, anytime you talk about COVID, people get pissed off. So one thing I like about myself, when they get pissed off and they know me, do I back off? No, I give them more. I give them something to be mad about. I used to do that with my children too. When they get mad and I punish them, I give them more to get mad about. That's only if they've done something that I told them not to do. Because if they get them, I was good for that though. I hurt their feelings, they start crying, I give them a tissue. And I give them about 10 minutes. All right, I understand that you're crying. Because my mother used to, we get a spanking, we start crying because we were told something, and to keep a straight face, she'd pick up a belt. I'm a little better than that. I give them a tissue. Okay, you're crying. We still got to do this, so here's your tissue. Anyway. Here's a story, and this is one I've held on for a few days, but I thought it was apropos since I'm going to piss people off. And plus, I just posted some new numbers from Florida. Florida's going bonkers, man, and this is the summertime. This is normally the low season. COVID, if COVID has a pattern, you get a summer season that's like from June to about maybe September, and then you get a little bit of slack in September, and then you get the big ones, the start of the big one, which is October, November, December, and January, which is the high season. And the differences that I see is that we've cut out the social distancing and actually stop using the mask. So that's the biggest thing that I've seen that's going to be a test. But I'll give my commentary after I read the article, okay? U.S. sends hundreds of ventilators to Florida as COVID surge continues. The federal government has sent hundreds of ventilators and other equipment this week to help Florida respond to a record number of COVID hospitalizations. The devices, which came from the federal government's strategic national stockpile, remember that when they confiscated all the ventilators that California was trying to buy and New York was trying to buy, and they intercepted them, they actually put them into the stockpile. This is where they went. Included 200 ventilators and 100 smaller breathing devices and related supplies, said an official of the Department of Health and Human Services. A record number of people have been hospitalized in Florida in a surge of COVID infections being driven largely by the unvaccinated, public health officials have said. On Tuesday, 14,787 people were hospitalized for COVID-19, 145% more than during the state's previous peak in July 2020. According to the Florida Hospital Association, nearly 90% of the state's intensive care beds were in use, and 85% of all patients' beds were filled, the group said. There is a rapid, accelerated rise that is unprecedented, University of Florida Health Shands CEO Ed Jimenez said on MSNBC. At his hospital, 90% of the patients are unvaccinated, he said. Local and state health officials request equipment from the stockpile. Governor Ron DeSantis said he was unaware of the federal allocation when he was asked about it Tuesday by WPLG of TV of Miami, which first reported on the ventilators. Come on, Governor Ron. BS. I have not heard about that, so I have to check to see if it's true or not, he told the station. I would honestly doubt that that's true, but I'll look. We have a lot of stuff that we stockpiled over the last year and a half through the Department of Energy and Management. I have not had any requests across my desk. I haven't been notified of that. DeSantis has been in a sparring match with the Biden administration in recent days over his implementation of a ban on mask requirements. President Joe Biden said Tuesday that the administration is looking into whether any federal action could allow Florida schools to require masks. Last week, DeSantis alleged that Biden's immigration policies had led to the wave of COVID infections, not low vaccination rates. Well, we'll see, one way or the other. People think that the vaccine is the lab test, or that to see that the vaccines actually work as a lab, making you lab rats. This is a lab rat, okay? This is state by state being a lab rat to see if people can work in a normal setting, go back to their normal lives, and see what the COVID rate is, to see if what the death rate is. Because previously, before the death rates and the infections and the cases actually rose, Trump and the governors actually put states into a semi-lockdown. It wasn't really a complete lockdown. The complete lockdowns were much like Italy did, like Spain did, like China did in Wuhan. Those are lockdowns when you can't come out of your house. And you can't come out on the street unless it's designated, like during special times, or you're going to appointments like a hospital or something else, right? That's the only time you can actually be on the street. You just can't walk around. Those are lockdowns. The U.S. never did that. Even California, who had more of a strict lockdown, even then, most people came out. Some people didn't wear masks. Some people didn't. Some people were supposed to stay out of stores. They didn't. There was supposed to be a curfew. They didn't adhere to the curfews. So we really never went into a lockdown like they would in other places. Like I think they're trying to do it semi in Australia. But then again, we did have the social distancing rules and the mask rules. Okay, this year we don't have it. So we're going to get a good test. So if you thought you were lab rats last year, you thought that was unfair last year, they're going to find out. They're going to find out exactly what the COVID do. Because you have all these unvaccinated people that never had COVID, that never had a taste of COVID, right? Of all ages. and the COVID was suppressed because you did have implement all these restrictions and lockdowns. Now you're going to get full force. Now we're going to see what the Delta variant, what it really will do, okay? What it really does. So if you thought you had fun last year, wait till you see this year. In other words, like the Joker said, wait till they get a load of me. So all I can say, folks, at this point, and I'm not even going to say it, I would tell you to be careful, be safe, keep your distance, put your mask on. But you know what? Eat, drink, and be merry. You do what you do. If you catch it, you catch it. If you live, you live. If you die, you die. At least you go out doing what you want, right? So whether it's not getting a vaccine, whether it's not wearing a mask, whether it's not keeping social distancing, whether it's being in a crowd, I say have at it. Because if it was me, I'd have cut that stuff off last summer. Let them out. Okay, they don't want to be inside. They don't want to wear a mask. They don't want to take a vaccine. Let them out. Let them take their chances. And when you push your kids back in school, you're going to make them take their chances, right? We already had a school shut down in Florida. In Broward County, they sent like 500 kids home. But also the reason they did that because they had 3 teachers die. 3 teachers died from COVID. They had EMTs die from the Delta virus. And they were vaccinated. This is not something to play with. I've been trying to tell you guys. This ain't something to play with. This is not, in my opinion, a naturally occurring disease. This thing was engineered to do what it does. And if what they're saying this thing is engineered for, and it's supposed to avoid and evade your immune system, which is something that Nicole hinted at. She didn't say it because she can't say it because in her position, she can't be definitive. When she looked at it, and she's qualified to look at it because she's a genetic engineer, the things that they put into this are there to evade your immune system. Like the Delta virus. Man, it's got double, I think it's double, even 4 times the H2 receptors, 4 times the cleavage sites than the original COVID-2 virus, than the A variant. The D variant's got 4 times. That means it's 4 times as contagious. It means it's 4 times as hard to get rid of. Now, whether it's a mutation or whether it's an intentional release, at this point, it doesn't matter. This is nothing to play with. So if you're out there playing around with it, you don't believe in it, you believe that it's a pandemic, good for you. All I would say is take your rabbit foot, your holy water, and your crucifix out with you because you're going to need good luck and prayer all wrapped up in one. If you're, like Busy Rand said he was planning an international trip and he was headed through Florida. He ain't going. And I don't blame him. Do what you do. But if you're going to do what you do and you're not going to take a vaccine or you're not going to put on a mask, you're not going to take those precautions, at least use some common sense. Don't go anywhere where there's a big crowd. Stay away from the hot spots. Down south are hot spots. Give yourself a fighting chance. If you're in the West, stay in the West. Do not go down south. I'd rather go to New York right now. With those red states, I'd stay out of the red states. Texas is not, Texas is growing, man. Florida's on the leading edge right now. It was New York, but Florida's on the leading edge right now. And Texas is not far behind. You got the little states like Arkansas, and Alabama, and Mississippi, and Louisiana that are tearing things out of the frame, running out of hospital beds and stuff. That's what I look at. That's what I posted. Basically, Florida's up as far as cases, hospitalizations, and deaths. So if you didn't believe it last year, believe it this year, because Florida's already there where they were last year. They're already there. And if Florida portends upward, like they are doing right now, and certain other states, the red states are portending upward right now, it won't be long before the blue states catch it. But we have so many Billy Badasses out here that want to go out and tempt fate. Like I say, eat, drink, and be merry. I wish I could say, hey, if you don't believe in a vaccine, don't believe in safety precautions, you don't believe in Western medicine, if you can't breathe, don't go. Stay home and die in peace. That's what the medical professionals are saying. But I know that's not going to happen. When you guys can't breathe and you're turning blue, you're going to call that 911. You're going to get into that ambulance. They're going to get in that paramedic. They're going to put a tube in. You're going to pray to God that you live. We all know that's going to happen, right? All of a sudden, you're going to have all this confidence in the world in Western medicine. We all know, right? People say there are no atheists in foxholes, right? And there are no non-believers in Western medicine in hospital beds, especially on a freaking ventilator. So we're going to see how many people stand on their square and stand on their conviction this year. Because Delta's just getting started. Delta's just getting started. This is the summer, and it hasn't really spread yet. Wait till the winter time. As Kevin says, winter is coming. And when the Ice King appears, that's when you know it's over. But hopefully we can keep that at bay. Maybe then, maybe not. With that, that's all I got for this time. This is BGS out, and I'll see you guys on the next.